lecturing is similar to tutoring, isn't it? I think obviously you need to have good, strong knowledge of your subject, of what you're lecturing in, what you're tutoring in even. And again, it's that sort of communication skills, being able to make really complex ideas and sort of theory easy for people to understand. So those skills to be able to break things down so that people can learn it and then sort of build upon it. Um, and again, listening skills, sort of listening to what the student needs and what they're asking you and responding to that, not necessarily like what you've got on your plan. You might have a plan that I want to get through all this stuff, but really it's a kind of responsive role as well. Um, but so the lecturing as a guest lecturer, I come from my kind of industry experience, but I know if you need like a permanent role as a lecturer, they're looking for kind of master's PhD levels.
Hello, my name's Jenna. I'm an online primary tutor, and today I'm talking to Sarah about how to become a tutor after working in hospitals. If you are a tutor watching this video, let me know in the comments down below, especially if you have come from another career and moved on to becoming a tutor. Thank you very much for joining me today, Sarah.
Oh, thanks, Jenna. Thanks for having me.
So we got in touch on Facebook. You very kindly reached out to me, and I asked you a little bit of details about what you'd done before tutoring, and it was really fascinating. So I was really pleased that you agreed to chat to me.
Oh, well, thanks.
So we'll look at your background before becoming a tutor,
Yeah,
and I'm just going to refer to my notes as I said to you earlier, just in case I don't want to get anything wrong. So
it's
before you
fine.
became a tutor, you were a clinical physiologist and national clinical governance manager working in hospitals. Can you tell me about these roles, please?
Yeah, well done for the pronunciation. That's quite hard. It's a long mouthful, as you know. Yeah, so a physiologist is somebody who studies the function of living organisms, and so really it's very biological. And a clinical physiologist works in hospitals, and they kind of run lots of different tests on people. So people will come in for sort of different tests for various reasons. Either they want like a full health screen, just to check the health of their body, or people come in for medical or insurance reasons. We have pilots that used to come in and needed, a full medical before they were allowed to fly and things. So you take things like bloods, you'll run ECGs, which is for your heart, and you'll run stress ECGs as well, which is getting them exercising, looking at what the heart is doing. It could be urine tests, stool tests, um, all sorts of things, blood pressure, body composition, that kind of thing. And really, in the hospital setting, you're looking at whether that person or that patient is well, is healthy and well. Is there anything you can do to maybe help them become healthier? Or you're kind of looking for any signs of illness that's already there. Or can you see something that's kind of flagging up before they have symptoms? And maybe we can get in early and prevent anything happening. So that was really kind of my role as a physiologist. And I used to manage a team in the southeast area for one of the largest sort of private healthcare providers in the UK. And then after a few years of that, got promoted to a national governance manager, clinical governance manager. Yeah, again, the longest job title. Um, and that really involved looking after the entire UK team of physiologists
Oh,
for that
wow.
company. So yeah, it's a big role. And governance in a sort of clinical setting is making sure that everybody is safe enough and skilled enough to do the job, so that you can't just kind of enter that role and be let loose on patients. There's a lot of training that you have to do once you enter the company. So it involves training, clinical training physiologists with the skills that they need. It involved kind of a lot of auditing, Jenna, like a lot of going up and down the country, visiting every single hospital, making sure policies were being followed. So, as a private healthcare provider, and also in NHS, you sort of follow mostly NICE guidelines, which is the National Institute of health and care excellence, and they set the kind of standard that people should be working towards. And it was my job to ensure everybody was working at that standard. And if it wasn't there, then we had to get them there and support them to do that. Yeah, so lots of travel up and down the country. One day I'd be in Exeter, the next day would be London, then it'd be Leeds. So lots and lots of travel. But I really loved that career. It was a really, really good role to do.
And did you
Yeah.
mind the travelling?
At the time, no, no. I was kind of set somewhere 2 or 3 days a week. So I was in Surrey, which is where I live now, and then the other sort of 2 or 3 days I'd sort of be traveling around. And in your sort of late 20s, that felt quite exciting to be in that sort of job role. So it didn't bother me at the time. No, it didn't bother me.
And did
Yeah.
you feel pressure from the job? Because that's a lot of work on one person's shoulders to do that.
Yeah, and so obviously I had a team so I said when I was physiologist, I managed the sort of southeast team, and then as you work up, you manage the managers, if you like. And there was like 9 or 10 managers, and then they have their teams and so on.
Oh, okay.
But it is still, yeah, you're right. It's a lot of, I'd say, pressure, sometimes stressful. The workload can be stressful. But I found the previous role, the physiologist job, more stressful, where it's the day in, day out of sort of hospital life, like seeing, 8 people a day, 8 patients a day, and making sure everybody's on time, and, making sure it's sort of the department runs like clockwork. I think that was more kind of pressure, rushing around the place. Yeah, making sure all the tests were done and that everybody could leave on time as well. So one of these kind of full health tests takes 3 hours. So you work with
Oh,
a
I didn't
doctor, and
realise.
yeah, so the physiologist has 2 hours with the person, and then like a doctor would have an hour with that person if there was anything that they needed to kind of go on and talk to the doctor about. So it's long. It's long. Yeah, it's a long day. But the governance role, I don't know, I guess you have sort of more control, and as a manager in that respect, the sort of higher up you go, it's a lot more people management. And I'm a bit of a sadder in that I do like kind of policies and procedures and writing policies and rolling them out, and yeah, I kind of really enjoyed that aspect of my role.
And
Yeah.
how was it managing people? Because that can be quite tricky depending on the role
Yeah.
that you're in.
It is. It is tricky. People are tricky, aren't they? It's
Yeah.
managing different personalities and how they lead their teams. I think on the whole, I did quite well, which has lended itself to kind of tutoring, in that, I'm good at communicating with people. I'm good at kind of listening to people. I'm not an autocratic kind of manager, or I don't have that leadership style. I'm sort of more democratic, so I'd listen to the team. Obviously, when you've got something that needs to be followed, let's say, you've got to take bloods in a certain way and you've got to dispose of sharps like this, you have to be really like, this is what you're doing. I know you don't want to do it that way, or you don't like wearing gloves, or whatever it may be. Or the big one was sleeves,
Oh,
kind of have to be elbow length. They shouldn't be down to wrists, and or really rolled up. And so there are, people get a little bit funny about it, the team, but you had to kind of be strict for a reason. I think as long as you explain reasons to people, like why things are done that way, people are more likely to be on side. So if they see a why, then they are sort of more likely to kind of follow. But there's always personalities that don't get on so well or clash, and you have to realize you're not going to be friends with everybody, and they're not going to be friends with you, and and it's just a kind of work relationship. Yeah, it's
oh,
tricky.
wow.
Yeah.
Yeah, there's always
Yeah.
things that come with like in teaching, especially if you go from a class
Yeah.
teacher to a subject lead, you're no longer just their friends, and you no
Yeah.
longer, well, when you go up, you then need things from them, and it gets
Yeah.
kind of awkward, and no one really teaches you that, how to manage people.
That's so
Um,
true, especially when you've come up, Jenna. That's so true, because people that you once socialized with and went out with, it's suddenly a really
It can get a
different
bit
dynamic.
awkward.
Yeah, it's a
Yeah.
really different dynamic. I noticed people laughed at me different. I know that sounds weird, but like if I'd crack a joke, a lot more people would kind of laugh, but it wasn't sincere. It felt odd. It was like, oh, are you just doing that because I'm your boss? Or it was
Yeah,
really, you
definitely.
do notice changes. Yeah,
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 definitely. So you were a guest lecturer at Kingston University, and what was this
yeah.
about? What were your lectures about?
So really similar. I kind of did it alongside the previous roles. And I was invited. So for around 9 years, I used to come in every year and do some guest lectures. So maybe 2 or 3 lectures for what's called level 5 or level 6. That's second year, third year undergrads, and on physiology. But more so in what it's like to work in an applied setting, because you would know, you learn so much stuff on your degree, and then you come out and you do the job, and it's entirely different. You learn so much more on the job. I think nobody really teaches you how to work in applied settings. Like, how do you use those skills that you've acquired through your studies, and what do those studies mean? How do you apply it to like your workplace? Or and so a lot of the role I was doing was also applied psychology, because that's the hardest part of the job, I'd say, is getting people to change their health behaviors. You can tell people, right, you need to lose some weight, you need to stop smoking, you need to cut down your drinking, but just because you tell someone that, they won't go away and do it. People are really stubborn. They dig their heels in and go, no thanks. Or I tried, and I still, smoke 20 a day or whatever. And you can see the signs of like heart disease going up or whatever. But shock tactics don't work either. So one of the things I was doing going into doing these lectures is um, telling students about kind of case studies and sort of how you'd work with people, and to change their health behavior, and as well as kind of like the science side of it as well. But yeah, it was just kind of giving them a place to discuss career opportunities, and explore that role more. Maybe they hadn't considered sort of going into physiology, because it's most people think of, oh, I'll stay on for academia. I'll stay on, do a master's, or I'll go into PhD. And actually, that was when I was at university. That's what I wanted to do.
Mm.
I wanted to go in academia. But I met my husband at university, and he was in a similar position, and his place of work said, we'll pay for your PhD. So he did the PhD, and I went down the applied route because I was like, well, I can't really afford to go down in salary or whatever. Yeah, or do that salary. So it was, yeah, I really enjoyed going into those lectures, but they kind of naturally come to an end when I started the tutoring, because I thought, I've moved on now. I've like moved on to a different career. So yeah.
So before we go on to your tutoring, what
Mm.
key skills do you think you need to use for doing a lecturing role?
Sort of lecturing is similar to tutoring, isn't it? I think obviously you need to have good, strong knowledge of your subject, of what you're lecturing in, what you're tutoring in, even. And again, it's that sort of communication skills, being able to make really complex ideas and sort of theory easy for people to understand. So those skills to be able to break things down so that people can learn it and then sort of build upon it. Um, and again, listening skills, sort of listening to what the student needs and what they're asking you, and responding to that, not necessarily like what you've got on your plan. You might have a plan that, I want to get through all this stuff, but really it's a kind of responsive role as well. Um, but so the lecturing as a guest lecturer, I come from my kind of industry experience, but I know if you need like a permanent role as a lecturer, they're looking for kind of master's PhD level. So
Wow.
definitely that sort of higher level of education. So it was nice for me to dip in and out of it, really, and it still get to experience it, even though that didn't end up where my job was. Yeah.
So then what made you then want to eventually quit working in hospitals?
It was well, it's children. I felt
Oh,
pregnant.
okay.
It was children. It was children. So I had my son, and I knew that I probably wouldn't go back because I was doing all that traveling, Jenna. I was doing 60 plus hour
Oh,
weeks,
wow,
especially
that's
with the
hard.
travel. Yeah, just trying to fit everything in, paperwork and so on. And this was days where traveling where you didn't have the functionality of Zoom. There wasn't so much online video calls, and you couldn't necessarily do all your work. You couldn't connect on Wi-Fi on trains, and all of that didn't exist. So, so you had to kind of fit. I had to fit like all the paperwork stuff around it. Um, and it was a very, very difficult decision for me because I really enjoyed that. And I just didn't know whether I'd go back to a science role. Um, Unfortunately, at the time, the employer said that I couldn't come back part time. It was full time or nothing. And I knew that when I had children, I really wanted to be present for that, certainly like that first few years of their life, because developmentally that's really important. Um, but in hindsight, I now know it's the right decision. But at the time, I would say like the first couple of years, I grieved that kind of loss of that career,
Yeah.
which sounds a strong word. But I think when you do lose, especially kind of new mothers, your first child, it's such a massive change from
It's
anything
your
else.
identity, isn't it? In a way, someone
Yeah,
else talked to me
yeah,
about that, and she said they just wanted their identity back, as well as
yeah,
being a mum, um,
yeah,
because they were
yeah,
quite overwhelmed.
absolutely. Yeah,
Yeah.
I felt a bit of grief, like it was gone. That the door had shut and that's now gone. And then you're left in this place of, well, I don't know what's next. I have no idea where my identity is anymore. I know I'm a mother, but I'm also like Sarah and I don't know who Sarah's going to be. So it was hard, but looking back, definitely 100% the right decision to have made.
Mm.
Um, so but it's difficult. But I think children are fantastic catalysts for change. They are the ultimate kind of speeding up a change. And with each, I've got two children. With each child was a new change. So yeah, so I wouldn't change it.
And
I
it's
wouldn't
quite
change it.
common that a lot of jobs don't offer part-time. Even in teaching now,
Yeah,
you're very, very lucky to get a part-time role. Um,
yeah,
Mothers or fathers. It's not, I don't really hear of many
yeah,
fathers being able to get part-time roles. It doesn't seem to be
yeah,
the way. But
yeah,
there's only been a few teachers I've ever come across that have been lucky, because obviously there's a lot more costs if you go part-time for the school or
yeah,
for, I
yeah,
imagine, where you came from. So then
yeah.
how did you first hear about tutoring? Was it through the lecturing or something else?
No, completely different. It was kind of a bit potlucky, really. So I was doing like a variety of jobs while the kids were small. I was waiting for my husband to come home from work, and I was going out in the evening, or I was doing Saturdays. So, I worked at the local library. I worked at the cinema and the theatre near to me, scrubbing the bars at like midnight.
Oh, wow, you did
um,
a whole range of
yeah,
stuff then.
yeah. And then I worked with special educational needs children on Saturdays. So I helped run like a play. I don't want to call it playgroup because they were like age 4 to 12, but it was
Okay.
just a day where the parents could go and get some respite and be with their other children and do activities. And then me and a team of volunteers would kind of run the day and teach life skills and maybe take them out for lunch and things. But that role couldn't give me any more hours, and I wanted to kind of get back into work as my children started to go into school. Um, so it was Boxing Day actually, and I was scrolling through the phone, deciding because it's quite a reflective time of year. I was like, what am I going to do with my life? And I was scrolling
That's so
on a job site.
relatable.
Yeah, it's like it's Boxing Day. There's a new
What's
year. What am
next?
I doing? And I was scrolling through it, and I come across like an agency site, and they wanted a science tutor. And I
Oh,
thought it's flexible hours, they said, can be evenings. And I thought, this sounds quite good. This sounds all right. And they were, quite good in that they didn't require, because I don't have a teaching degree, they didn't require a teaching degree. So I thought maybe this is my way of kind of training people again and using my science again. And I said to my husband, I'll just do 2 hours a week. I'll just start small. I won't rock the boat. Now we're full time. Now we're full time.
Oh,
So yeah, I knew it was a good omen when the interview was on my birthday, and she said to me straight away, "When can you start?" And I was like, "Yes."
oh,
So
that's nice.
yeah, so it just kind of built up. That was with Tutor Doctor that I started
Oh, I
with.
haven't heard of
It's
that one.
yeah, it's quite it was quite a big agency, but I don't hear of them so much. They're sort of global, I think. But they did have a franchise in my area, which has since gone now. Um, but they were really nice to work for, yeah. So got in that way, and then after a year and a bit, I was like, they're taking a lot of commission. I could probably do this myself. So I set up what was then SB Tutoring Surrey. I've now lost the Surrey because I was getting students from lots of different places, and I thought, well, it's not just Surrey anymore. It's sort of UK wide and worldwide, and yeah.
So
So
before we move on to that
yeah,
part of your
yeah.
business career,
Hmm.
what would you say for people that are starting tutoring? Because a lot of tutors do start with that route. I did. You go to agencies
Yeah,
because, it takes a lot of work to find your own students. It's quite hard,
yeah.
the
Oh,
constant
yeah,
advertising. So what do you
yeah,
think are the benefits for finding Tutor Doctor or a similar tutoring agency
yeah.
for a brand new tutor?
I think it's a great way. For me, I'm the kind of person that I don't like to jump fully into things. I like to dip my toe in and see, am I okay with this? Is this right for me? And I think if you're not sure whether you want to go into tutoring or not, because I know there's a lot of teachers at the moment leaving the
Mm.
profession, that's a good way to dip it in, and it's flexible hours. So maybe like I started 2 hours a week, maybe because on top of a full-time job, that's enough probably. um and so agencies, I think, offer that safety net. They also kind of provide you with clients, like you said, Jenna. It's really hard. It can feel like a treadmill of eternally trying to get, especially this time of year in summer, you're trying to get students for the following kind of year. Can be tricky and worrying at that period of where in summer it's all gone quiet and you're not sure. So agencies can also get you work for kind of quieter periods of the year, holiday tuition, and they've got all their sort of policies and procedures in place. Because I know when I started my job that I found that sort of side of it like, oh, all right, I've got to get, you know, um, a terms and conditions kind of set up, and I've got to have maybe a GDPR set up and all of that. And so I think agencies can offer a little bit more safety net, and you can see how things are run
Mm.
before maybe starting your own business. You can see how somebody else's business is run and get experience that way.
And know what you
So
don't
yeah,
want, definitely.
yeah, yeah, because you'll
As
work
well
with
as
different
positives,
people.
but
Yeah.
also know what you won't accept. So then,
Mm.
what did you take from that experience and apply to your own business, or think, no, I'm not going to do that?
That's a good point. So there, I think Um, I initially, a really good point you just made there is kind of knowing what you don't want. And I think all tutors initially kind of start out accepting everything,
Oh,
so
yes.
yeah, and I was started off, I did a course on how to tutor the 11 plus, and I started doing 11 plus and realized I hate it. I hate it. I was like, this is not for me. I like working with older children and teenagers. And so it helped me narrow down really like sort of key stage 3, GCSE, and A level. I do biology, geography, and PE because they're my sort of specialisms. Geography because I just love it, and biology and PE sort of lend themselves to it. So it sort of helped me, yeah, with kind of putting those things in place. I know exactly where I'm going to market myself. Um, and I know what I need kind of in place to be a safe tutor as well, going back to policies, like an enhanced DBS check and all of these things, which actually I naturally had from some other roles that I was doing. But yeah, so I think agencies are a great way to start tutoring. And in fact, I still work for a few. They help me fill in some
The
gaps I
odd
might have in
gap,
the
yeah.
diary, and yeah, and so I do um, do that. And I think the other thing that parents used to say was that agencies are really, really expensive because obviously
Yes,
there's
because they
lots more
put their fee on
charges.
top, yeah. And you
So
don't always know what
yeah.
the fee's been put on top,
No.
because if
I
you
found out by
increase your
accident. Yeah.
prices, yeah,
Yeah. I
you
found out by
don't
parent from
always,
accident because she
yeah.
thrust it under my nose and it was triple what I would charge. I was like, what?
Mm.
I'm seeing like a third of that. I'm like, so I was like, well, in my own business, I won't charge commission, but I won't go that high either. So I am on the expensive scale now, but I've been a tutor for almost 10 years. And I think you do kind of place yourself where you are experience wise and things eventually. But yeah, when you're starting out, it's, like I say, good. And then I've relied on agencies sort of less and less as sort of word of mouth grows and things, that parents talk to other parents and yeah. So
And are you
yeah.
face to face? Are you online, or are you both?
I am both. I like the hybrid style. So this last year, I've changed everybody in the evening to online, and that's mostly because my husband's role has changed, and so he can't be home always, or he's traveling for his work, and so I needed something that I can be here with my own children. They can be downstairs doing homework, whatever, and then I can teach for a couple of hours. But I do face to face in the day, and then I can give parents a sort of preference as well for like Saturday mornings I work, so I can say we can have online or face to face, but I really do still like going out face to face. I go to students' homes rather than come to me. It would be chaos in my house. It would be chaos. But I go to their homes and I think, yeah, people find that convenient as well as online. And I run my groups online. So I've got a couple of groups each week for maths and science, GCSEs and Key Stage 3. And so I found that easier before COVID. I was running kind of some groups or some workshops in my local library, but just getting everybody together again from all different places, it was so much easier when it suddenly all become online, to be honest, with the group setting. Yeah.
So
Yeah.
what do you think for you personally are the benefits of face to face versus online benefits? What do you like about either?
Yeah, so face to face, I think there are some children that just really need that face to face interaction, particularly with children with SEN, ADHD, autism. I work with children with PDA, and they can be up and about, and they can be up and about as many times as they want. And as a science tutor, face to face is also perfect for doing your experiments. So I bring bags of stuff with me when I tutor. My boot is full of what most people would consider rubbish, but I consider treasure. It's like tutoring treasure. I've got chalk and paper plates, and it just looks like a giant trash bag. But I can bring in the bags, and face to face, you can do models, you can do experiments, and it's just really nice for those children. And I think, I work with a lot of homeschooling children, home educated children, and it's really nice to come into that world and see what they've been doing. They can bring their projects to me, and I always think tutoring's more like a discussion anyway, especially face to face. You're more like having a chat and getting some learning in there at the same time. But it's really, I think face to face lends itself for sort of hands on activities,
Mhm.
and socializing and things. And then online, I think is really convenient for, I'd say, more so older children actually. So, that kind of 14, 15 plus, like online world. They live in a sort of online world now. And it's really convenient. They can just hop on 45 minutes, an hour, and then leave, put in their earphones, and they're with you, and then they're done. Um, and of course, for the tutor, there's no traveling for me. It's quite nice to be here in my office and just kind of set. And also, it's convenient for my family life when I don't have, the other parent around, and I know my children are okay, and I'm not leaving the house or anything. They can be looked after. So convenient for family life, but also I think for tutees' family life as well, that they can sort of hop on and off. Yeah,
So I've
yeah.
got two questions based on that. Your
Go on.
science, do you do
Mm.
experiments with them online?
I don't often. I do, and not many. I mean,
Is it more
mostly
theory
because,
based?
yeah, more theory based. And I think also that older children like more theory based. There's a definite exam focus when you get into GCSE years. And I know it's not nice to think about it that way, but parents do pay you for an
Yeah,
outcome.
definitely
They
as they
want
get
an
older, yeah.
outcome, yeah. Um, with the homeschooling students, yeah, I can do. Most of them are face to face, to be fair, but
Yeah.
I do some experiments. But I know you're really good with your. I think your experiments or your baking. I follow it, and yeah, I love that.
Oh,
And I think as creative as possible. But what I can do online is, I've got loads of resources in my head that I use with because I teach maths as well, tutor maths. So loads of game kind of sites, visual
yeah.
sites that they can and I can share the link and they can come on and share their screen and I can see what they're doing. They can do puzzles with me, crosswords. I found a great quiz site that I love. Um, and so we can kind of, and they can go on the whiteboard and draw things with me. So there's lots of kind of scientific labeling that you have to do. And it's really nice for them to be able to draw and get interactive with it. So there's still like plenty of resources, but less so kind of experimentation and mixing that and that sort of thing. Yeah.
What about
Yeah.
PE? Is that face to face or because I've got a friend who does PE as well, and she's looked into doing
Yeah.
like online clubs and stuff, online
Yeah.
videos. But how do you do PE? Is it face to face or do you do both?
So the PEI tutor is GCSE and A level, and so it's not physical component because the child will do them in school or college.
Oh,
But
okay, that
I
makes
tutor
sense.
the theory, yeah, and there's a big chunk of anatomy and physiology in there, a big chunk of psychology, and then the
Oh, right up
sociology
your street.
history.
Yeah.
Yeah, so the history, sociology side of sport. So there's a lot of science in there. There's a lot of physics in there with biomechanics and so that's ultimately what I would tutor, Jenna, yeah, rather than the physical side. I mean, in my tutoring sessions face to face, I am known for being quite active. I am known for getting them out in the garden, and I've done math sessions on a trampoline. I've done, I've done sports day races, but mathsy and physicsy, where we're looking at
Oh, that's
distance, speed, and
amazing.
time. Yeah, I do. I just get involved, Jenna, because I'm quite sporty myself. I'm really into kind of like fitness, and so like if I can drag them out for a bit of a
And are
PE slash
parents
maths lesson.
supportive of it?
Yeah, they love it. They're like, have them, get them out off the screen. No,
That's
they are
good.
really supportive because I think the more creative, especially with the home schooled students, the more creative you make it, the more parents love it because they think this is brilliant. We didn't really want to be sitting down at a desk for hours at a day. That's not why we chose homeschooling. um, and it's to make it kind of fun and learning a different way. And so, yeah, parents really like it, and they're always keen to see what we've done for that lesson. And yeah, it's good fun.
And you work with home educating children, like you've mentioned,
Yeah,
homeschooling children.
yeah,
How did that come up? Because when you do become a tutor, that is obviously a lot of people want daytime work, and
yeah,
homeschooling, home education families are like what tutors really hope to be able to work
yeah,
with. They really want to work with these families. So how did you
yeah.
come across home education families?
Again, it was through kind of my advertising on sort of Facebook, and I think it was word of mouth. I had a student that was in mainstream school, and they went to the same church as another family that was home
Oh,
educating.
okay.
So they contacted me, um, and I saw that boy right from age 11 all the way through to 17 and saw him through
Wow, that's
his
amazing.
exams. Yeah, and so I picked up more and more sort of home educating families just from that experience, really. And I thought, I love this. One, it fills the daytime gap, which is great. But I also really, really enjoyed the experience of doing all the fun stuff and then also having a focus because the exams weren't all at the end that we kind of spaced it. He sat three sort of sittings, I think. and that was just wonderful to see him sort of go through and build the confidence and, oh, I've got that exam done, now we do this one. And it's not always exam focused. I've got home ed families that actually are quite like anti exam with me at the moment.
Oh,
So it's nice to be able to kind of tailor it, I guess. But yeah, and then you get known again, it's kind of word of mouth that builds it. And then all of a sudden, you've got these years of experience that you can then advertise with and say, actually, yeah, I've got this many students I've seen through exams, or this is kind of what my home schooling looks like, home education looks like when I come in and tutor. Yes, I will be running around like a lunatic with your dog outside and your child, or we'll be sitting down doing this, or, yeah,
oh.
yeah.
So obviously you've got your hospital background, you've got your lecturing background, you've been a tutor of 10 years plus. Over the years, obviously you don't have the, like you say, you don't have the teaching qualification, but have you done any training over those 10 years just for yourself personally?
Yeah, I try and do CPD every year actually. And I usually have a focus that I want for that year. So, yeah, and certainly when I started tutoring, I was acutely aware that I'm a small, very small fish in a very big pond, and I don't have teaching qualifications. So I have kind of self-taught a little bit of pedagogy, books. I've got books at my feet actually on that.
Oh,
Um, and I've done some CPD with the Dyslexia Association, and they run a wonderful one this year with dyscalculia with it. Being a maths tutor, I want to find out more about that, and I've had some students with that. Um, and I'm going to the TESS SEN show this year, and just
okay.
doing some CPD with them. They've got talks and seminars that you can pay for and dip in and out of picking and
Oh, I'll
choosing.
get the
For
details off you after about that.
Oh, it
Sounds
looks
super.
brilliant. Yeah, so I've chosen one about working with children with SEN and AI. And then I think I've got a math specific one that I'm going to as well, maybe a dyscalculia one, I think it is. So I try and do something every year. And as a member of the Tutors Association, they've also run free CPD. So
Yes,
I
they do it
try and
every summer,
do,
don't they? Yeah.
yeah, but also throughout the year, they've got a platform. At the moment, it changes. So at the moment, it's from a company called Academize. I think they're called
Okay.
Academize. And you can pick and choose CPD modules again from them on all sorts of things, teacher related, pedagogy related, safeguarding, all sorts of things. Yeah, to keep up your CPD. But it is on the tutor. You have to go find these things. You have
Yeah.
to want to do it. But I think it's really important to keep up with CPD. And I know teachers have to do a lot of CPD.
Oh,
And when
yes.
I was in, yes, oh, yes. And when I was in my scientist roles, absolutely CPD, you did your CPD, because if you didn't, that you have no job. There was no option. You must do your CPD.
Yeah, especially where
um,
you worked.
no, I
Definitely.
think for teachers, is it not the same? Is it that it's a requirement? It's not
Yeah, there's
optional?
so much you've got to do every year, and like every week you have a staff meeting plus whatever
Yeah,
else is on the go. Every
yeah,
September you go back, you have to have like however many days of inset. At the end of the year, you've got to have days of inset, so there is a certain
goodness.
number. But
There's a
you've
big
also done,
expectation. Yeah,
yeah,
yeah.
definitely. You've also done work with the Tutor Association. If you want to tell me a little bit
Yeah.
about that.
Yeah, so I become a member in 2020 because lockdown suddenly, right, I lost pretty much 90% of my business in the 2 weeks after we locked down.
Oh wow.
And then it like exponentially grew after that 2 weeks. So I think we had 2 weeks of everybody homeschooling their kids, and they went, right, we're getting a tutor. And all of a sudden my business like exploded, and I couldn't, it was just so much. And I thought, I don't have everything in place yet. I suddenly I was thinking my terms and conditions are a bit rubbish, and I don't want people walking all over me. And I haven't really clearly set this out, and I didn't have a website at the time either, Jenna. So I just didn't look together enough for my kind of expectation. I thought this business doesn't look well put together yet. So I joined the Tutors Association because they've got templates on things like GDPR you can use and kind of put your logo on and change it to how you want it. They've got template terms and conditions if you're starting out. And I wasn't starting out then, but I did need to tighten it all up. And they've got all this CPD for free if you're a member that you can choose from. And I thought, oh, well, that's really good. And so since I've been a member, I have got more involved. So kind of I guess I won an award with them in
Oh wow,
2022.
congratulations.
Yeah, thank you. So I won Professional Tutor of the Year in 2022,
Oh,
which was like huge. It come out of nowhere for me. And yeah, I got nominated and I won that. And that I felt like I've got to do something with that. What's the point of winning an award if you just kind of go back to normal and sit on it? I feel like I should give something to the profession or whatever, and kind of work with them. And so since then, it's keeping on the home education theme. I was chatting with another tutor on LinkedIn. She's called Emma White from Mark My Papers, and we were just saying there's no real decent guidance for people who are home schooling or home educating and they want a tutor. There's no one place you can go that kind of explains the decision, and not to kind of make people go into home education. It's not right for everybody, but to give a balanced view of what the day could look like for you or a week. So we decided, I said, right, this doesn't exist. Let's make it exist. I'm good at writing policies. So I said,
you
right,
love
we'll put
it.
something. I love it. I love it. I said, let's put something together. And we had a few meetings and then we approached the Tutors Association and said, look, this is what we want to do. Can it go on your website? And we worked with John Nichols, who's the current president, and he said, yeah, sure. Been wanting to put something about this for ages. Go and do it and we'll look at it. And now it's up. So there's a large kind of document on their website for anybody looking into homeschooling and making that decision, especially if they're looking to go through exams as a private candidate, because that's really daunting, I think.
Oh,
For a lot of parents, it's really overwhelming when it's
yeah.
fine teaching the day to day, but then suddenly there's a bit more on the line. There's a bit more pressure of like, oh, we want to get mass exam for the next whatever phase of that child's life. So it just kind of outlines the reality of it, I guess, the costs of it, yeah,
Because a lot of
what you
parents
need.
don't realise they have to pay for it. A lot of
Yeah,
questions I see online are like,
yeah.
well, who funds it? And everyone's like, well, you've chosen to take your
You
child out of
do.
school,
Yeah.
you have to fund it. And a lot of parents don't realise that. And I did a post quite a while ago now because I've noticed, a lot of children struggle in schools, but parents, out of panic, just pull their child out without doing any
Yeah.
prior research.
And that's
Like,
exactly what it was for,
yeah.
Jenna. It was for those parents. In fact, I've directed parents to it and had a parents where the child was in end of year 10, was going to pull out. And I thought, oh, that's like a really precarious point to pull your child out. Um, And actually, they said, go away, read this. This is the reality of it. Both of them worked in full time, heavy jobs,
Mm,
other children. And actually, they went, actually, when we've read that, we've realised now that one of us would have to be around. It's going to change the whole working practice we do, family. And it's probably not the best decision when she's got 1 year left. And then
mm,
we can pull her out and she can go, to college or into work or whatever it may be. But
mm.
like I said, it's not designed to convince people, but it's designed to inform the reality of what it's like. And you're right, the cost is a big factor.
Mm,
And having a parent that's around, that can be around at home and
yes, definitely.
facilitate learning and trips out and whatever else they want their sort of home education to look like. Yeah, it's difficult. It's very, very challenging if both parents are going to work sort of full time
Mm.
and
And I think,
juggling that as
yeah,
well.
the more
Yeah,
knowledge you have, the better decision you can make
yeah,
for your child. And,
yeah,
I can understand parents who are in really difficult positions if they see their child
yeah.
really unhappy.
Yeah,
But it is your child's future at the end of the day. And for
yeah,
your child, it is better to research. Yes, of course, if you want to take them out, that's your right, but do
mm,
the research, like you say. But
yeah.
please send me the link and I'll put it down below in the description to that document in case
Oh,
anybody
okay.
wants to
Yeah,
read it or anything, because that'll be really
yeah,
helpful. So we're nearly at
Perfect.
the end, but before we finish off, you talked about obviously collaborating with that tutor on that document. Have you done
Yeah.
any other type of collaboration with other tutors?
Yeah, I'm always open to it. So if there's anybody watching that wants to do something with me or got an idea, I'm always open to that. I love that. I've worked with Arthur Moore, so his business is More Edu, and he's a maths tutor
Okay.
for GCSE, and we put together a free course that, and again, I'll try and find the link for you, Jenna. But it's a free course. It's kind of get ready for your GCSE maths and science exams. And he made some videos on these exam papers and how to approach these questions. And I did the same for the sciences, but with more of a exam technique focus rather than knowledge focus. It's kind of like when you see this question, what does it mean and how do you break it down? And so that's free. So that's a free video
That's
course
amazing.
for those students that's out there on the internet in the ether somewhere. Um, and that was really nice to make, really fun to make. And yeah, just always kind of looking to sort of collaborate really with people. Yeah,
Yeah, it does help your
yeah,
business a lot. When I first came out of tutoring,
yeah,
sorry, out of teaching, I was like, no, I'm going to do it all by myself. And then my first ever friend reached out to me, who's now like a really good friend. She's
yeah,
called Sarah as well, actually. And since then, it's just made my business do a lot better because
yeah.
you're collaborating and the more people you know, the more people that will pass you on and vice versa and that
Mm.
kind of thing. It really, really does help. If you are a new tutor
Helps,
starting
yeah.
out, make sure to connect, definitely.
Yeah, don't be on your own. And I think we kind of a lot of us start that way. And we're all, really fiercely independent, aren't we? When we start our own business, this is my business, and, and then you realise actually it can be really isolating and lonely as well. And so it's really nice to
Definitely.
know. I feel like they're all colleagues when I meet other tutors.
Yeah.
It's like a giant staff room, a nice sort of colleague staff
It's
room.
huge.
And yeah, when you go and meet people at conferences or like events or like the show that I'm going to go to, I'm really looking forward to meeting other people and chatting with them, and that's how I've met a lot of people and then connected on LinkedIn or vice versa, connected on like Facebook or LinkedIn and then gone and met them at another event face to face, and it just feels like yeah, you are kind of making friends, I guess, as well. Yeah,
Oh,
yeah.
well, to finish off, it's been absolutely brilliant. I've learned a lot from you, and I'm going to
Oh,
look up some of those
thanks.
courses that you recommended. What are you currently offering now, and where can people find you online?
Yeah, so science and math tutor. I am, yeah, tutoring from sort of age 11 upwards, right the way through to sort of A levels. So I do GCSE and maths and all the sciences, and then A level biology, PE, and geography. And I run groups as well. So I've got a key stage 3 maths group Tuesday evenings, and a GCSE maths group Tuesday evenings, and then a science group, GCSE group, Wednesday evenings. And you can find me on Facebook as SB Tutoring or my website, which is sbtutoringuk.com.
Oh, lovely. Well,
Thank you,
thank you so
Jenna.
much for chatting to me. It was really, really nice. I really
Oh,
enjoyed it. And we finally
yeah, it was great.
been able to talk, so that's lovely.
Yeah.
But thank you again. I really enjoyed it.
Oh, thanks, Jenna. It was lovely to talk to you.
If you liked today's video, please make sure to give it a thumbs up and subscribe to see who else I'm chatting to, and make sure to check out all the details down below. Thanks so much.